Hi, everyone. Thanks for joining us. Today, we've gathered some of our rockstar team members to chat about all of the big changes we're seeing in the delivery of healthcare since COVID hit. Joining us from CME, we have Shannon Trahan and Cindy Juhas. Shannon started her career in healthcare distribution in 1997. After joining Hospital Associates in October 2014, they merged with Claflin Medical Equipment in January 2015, and CME Corp was formed. She moved to North Cal in August 2015, where her adventure as an account manager began. She spent 2 years in the territory learning the business, and then in June 2017, she transferred home as the Texas, Louisiana, and New Mexico account manager. With CME's tremendous growth, she was able to achieve one of her career goals and joined the sales management team in April 2019. She enjoys coaching and mentoring her growing team and looks forward to seeing what the future holds for CME. Cindy currently is the Chief Strategy Officer for CME Corp. She helps facilitate the strategic planning process and establish annual key initiatives, as well as work with all the departments to set specific goals to support the initiatives. Previously, she was owner of Hospital Associates that merged with CME almost 6 years ago. She was VP of Marketing for both Henry Schein and McKesson prior to owning Hospital Associates. Cindy was the first woman chair of HIDA at the 100-year mark and the first woman to be inducted into the Medical Industry Hall of Fame. From Altus, we have Joe Hillebrand. Joe is the National Sales Director at Altus, an industry leader in point-of-care workstations. He has been with Altus since 2016 and has served in various roles on the sales team. His focus is on driving value to Altus customers and growing strategic and enterprise partnerships. Prior to Altus, Joe was a quantitative trader in the U.S. interest rate derivatives market based in Chicago. He attributes his analytical and strategic mindset to the years spent in the financial markets. These attributes transfer well in today's complex healthcare landscape and will position Altus to take advantages of opportunities to grow market share to help our goal of improving the delivery of healthcare. And I'm Sarah Leitz, Director of Product Marketing at Altus, and I'll be serving as the moderator for our chat. So let's get started with some of these questions. Cindy, this one's for you to start off. How has COVID changed the landscape for hospitals?
It's a great question, Sarah, and not easily answered because we don't really know everything that's going to happen. But, in the short term, we know that COVID has been a horrific financial loss to most of our hospital systems, all of our hospital systems. I think it's projected that, over $300 billion in losses will be attributed to the hospitals this year. So it's horrific. But I guess the good news is that the elective surgeries that has affected the finances greatly are back. I think last I heard they were 90 to 95% back, and there's a backlog of elective surgeries. So that's all good for our customers. I think the long-term issue that we still have yet to really realize is what's going to happen with the uninsured. There was a study done from February through May. There were 5.4 million people that lost their insurance. Different articles say that it's up to 12 million now, and it could be up over 25 million losing healthcare insurance. And when that happens, the hospitals lose too. And that's what the big unknown is right now, is what's going to happen, and are people going to get that insurance back? And that's yet to be seen. But hopefully, it won't be as bad as people think.
Joe, Shannon, do you have anything else you want to add?
Yes, I think that's a great point on the health insurance. The payer mix, I think, is going to be a huge issue going forward. As you mentioned, the backlog of surgery, July and August, reports that they were great months for hospitals, but those were largely, like you said, clearing up the backlogs of surgeries. That payer mix of the uninsured is going to certainly be on the front of every hospital executive's mind. The other thing is huge infrastructure costs that they face. During COVID, hospitals were using up to 45 masks per patient per day. Worst case, best case, 25. And now with some virtual efforts, they're down to about 3.5. Of course, the CDC has amended their guidelines a little bit. So, but that infrastructure cost is not going away. So you've got two factors: uninsured and a huge increase of cost for health insurance or health providers that are going to certainly affect how they do business in the future.
And of course, telehealth is on the forefront for everybody and trying to figure out the best ways to navigate that and deploy that in their systems.
Yeah. Speaking of telehealth, Joe, I'm going to throw this one back at you. Telehealth seems to be a big buzzword right now, but it's been around for years. What's so different now?
Well, I think all these technologies certainly existed prior to COVID, but there was some challenges both in reimbursement and hospitals spending the money to deploy these. What COVID did was essentially push this digital front door open and allowed for these hospitals to rapidly implement these strategies that they've had kind of sitting on the back burner or that were utilized very well within rural facilities. I hear stories, almost every single week about these massive implementations that these large health systems have gone through. And, we'll continue to hear about all these great integration stories and how they were able to launch and provide that patient-centered care.
I'd like to add to what Joe said. I think that, when you talk about telehealth, I'd like to expand that a little further and really talk about virtual healthcare, because it's not just about, doing more at-home appointments. It's really about, how can we do this better all the way around? How can we be more efficient and use technology? So there's a lot of physicians right now that are coming in as to confer with another physician about somebody's prognosis, and they will use the virtual world. So I think even within the hospital infrastructure, there's going to be a lot more touch points virtually, like in all of our lives right now, right? We're on a Zoom call. But I think that's part of it too. That's what's really different. We're going to be looking at ways to make virtual healthcare a part of everyday occurrence within the hospitals and outside of the hospitals.
Absolutely.
Yeah, and to add to what Cindy was saying, I actually had the experience of telehealth in a hospital. It's a rural facility in Texas 2 years ago. And, so that it was interesting to watch it in action, selling the products and being, in the industry. I was really intrigued to see how it was going to go. Unfortunately, it was for my mother-in-law, who had had just been diagnosed with brain cancer and had to have surgery. And they brought in, the monitor and had the doctor that was based in Houston calling into a nurse practitioner. So the interaction there, it was really interesting to see how it actually was implemented, and it was very effective. And, we were able to get the level of care that was surprising for the rural facility that she was, currently in.
Next question I have for you. This one I'm going to throw to you, Cindy. What are some of the other changes in the healthcare industry that are happening or may happen going forward?
I think that what I've been seeing, CME does a lot of work with new construction, and what we're seeing is a lot of redesigns going on right now. I think our healthcare system was hit hard. They did not have the capacity that was necessary to treat all the COVID patients, and that they all know it. So when they're designing their new facilities now, they're going to put lots of flexibility into the design. Rethinking. Even like a cafeteria. Do we build in an infrastructure where you can make the cafeteria into an ER or an ICU? And there's lots of thinking going on about that, and making even rooms that are not ICU, being flexible to turn them into ICU, having, all the necessary air and all the things that you need in an ICU, to make sure that it's available in other parts of the hospital. So I think that's one of the big changes that we're going to start seeing, is that flexibility in capacity.
Shannon, do you have anything else to add?
Sure. One area that I think healthcare is still struggling with is supply chain. Many of the IDNs are now working to diversify their supply strategy, and after experience of availability issues with their prime vendors during the early response to COVID-19, and I think finding alternatives to their prime vendor is going to be crucial as they go forward.
We've been talking about a lot of changes. And Shannon, this question's for you. Do you think that all the changes that have been happening because of COVID, are they here to stay?
I think so. And obviously, telehealth has the potential to improve the quality of healthcare and, make it more accessible to people across the country. And especially for those that are in rural, communities, where they've had limited ability to access healthcare. One of the things that's coming and is rolling out is 5G networks. With the rolling out of 5G networks that are expected to be at least 10 times faster than 4G, and could potentially be 100 times faster, some experts are saying, there's going to be a lot of opportunity for expanding telehealth and telemedicine in general. As the infrastructure continues to be upgraded, it is predicted that by 2030, 5G will bring a cost savings of approximately $94 billion per year to the healthcare industry, and drastically improve health outcomes. One of the biggest impacts of 5G will be on rural communities because it will eliminate the need to install wired landlines to meet the networking speeds required for telehealth solutions. It is estimated that there are 60 million rural Americans that are currently challenged with being too far away for quick visits to see their doctors in person, but they lack the network connectivity for telehealth visits. So, that's going to be significant for them once 5G is all rolled out and the infrastructure is in place.
Definitely sounds like it. Joe and Cindy, do you have anything else to add?
I just want to jump in and add one thing. When you talk about changes are here to stay, I think this one is still, the judge is still out on this, is whether or not telehealth can be profitable for the hospital. Right now, there's been, reimbursed, part of the CARES Act, they're being reimbursed now for telehealth. There's still some unknowns there. One of the things that CME has been, we talked to an insurance company not that long ago, and part of our services are that we have biomedical and technical services as part of our portfolio, and this insurance company was talking to us about, hey, we have all this equipment that we might have to send to a patient's home for monitoring, but then we would need it back when it's not required anymore. And right now there's no infrastructure. Well, we do that. We do direct to site delivery. We have technical service people that can check out the equipment to make sure it's working and have it set up in the home. But there's a reluctance to go forward with this until they know for sure that there's going to be reimbursements for all of this. I think there will be, but right now there's still some unknowns.
Mm-hmm. Absolutely. Joe, do you have anything else to add?
Yeah, just to touch on both their points, I think Shannon's point about the access to high-speed internet is going to be a crucial factor. You know how frustrating it is when you can drop a signal. Imagine being, in an appointment and you can't get through to the doctor, or, you get that spinning little hourglass. So access to high-quality internet, I think, is going to be a huge differentiator. And then what Cindy said, is whether it's going to prove to be profitable for hospitals. It's been said that telehealth and these virtual visits, they're not leading to surgical volumes that hospitals are accustomed to. Generally, the ED accounts for around 40% of surgical visits and 70% of hospital admissions. So, you take away that factor of ED visits, which are still down, 10 to 20%. And you wonder how they're going to fill that gap. So hospitals are going to be forced to look at this from a business model. As a patient myself, the telehealth is a promising future that I can log on and kind of see a primary care doctor. And it might not be an emergency situation, but as a hospital, not getting those patients into the door to see the primary care doc, then to see the specialist and then surgery, I think it's going to force them to rethink how they do business in the future.
Yeah, absolutely. So these last two questions are really for both the Altus team and the CME team, but I'll let Shannon and Cindy go first on this next question. How do you think COVID has impacted your business at CME?
Well, that's a really good question. I know we've all been very, very busy. And one of the great things about working with CME is our flexibility. And we have been able to really pivot during this time. And, as I mentioned earlier, being a resource for our customers for PPE, that's normally not our strong suit, but that's an area that we were able to really expand in. And we've actually added over 40 new vendors, including 7 new thermometer vendors. So trying to ramp up the supply to meet that the demand. So I feel like that's one area that definitely COVID has impacted our business, but in a positive way. I mean, we were able to find new sources and get those out to our customers.
Yeah, great.
To add to that story, when COVID first hit, like some businesses, not all, we got what we're calling the COVID bump, which was a lot of new facilities popping up all over the place. The Javits Center, the state of Rhode Island opened 3 hospitals. California opened a bunch of hospitals to take the overflow and or treat COVID patients. And all of those different facilities needed a lot of equipment. So we jumped on it and we were able to meet everybody's needs. I think we got the state of Rhode Island up and going in 3 weeks. And as we all know, there were so many shortages. We were sourcing from so many different places, even for the Javits Center, they wanted a certain kind of cot or bed. And we said, hey, we can get you this many of this kind, this many of this kind, and this many of this kind. And we got them all set up when they needed it. So that's one thing. But the other thing, since I am Chief Strategy Officer, that I want to talk about is rethinking strategy. We had to, like Shannon just mentioned, we're very flexible, and we jumped in and we had to rethink how we were going to go forward with our strategy. And we pivoted and made sure that not only were we able to go virtual, which is amazing, and get all of our customer interactions done from a virtual perspective. And I think it's actually been better, in the virtual world because, interacting with customers, we can actually get a whole team together to present to customers where a lot of times we couldn't get everybody flown in time or, schedules didn't allow for it. So we're really refocused on figuring out, what our customers need, how we're going to do that in this new world of virtual living.
Yeah, absolutely. And Joe, for you, how do you think COVID has impacted our business?
Yeah, for Altus, I think if you recall, Sarah, we sat down kind of pre-patient surge and had laid out the guidelines for a stress test on the business because the phones just were not ringing and activity shut down. And then, of course, we saw this huge spike in business when all these hospitals were getting overflowed. At that point, we kind of took a step back, doubled production. We relied heavily on our local suppliers who were shut down as non-essential manufacturers to help us deliver those raw materials so we could get product out the door.
And we had some suppliers that stayed open just for us.
Right. And now post-patient surge, as we're all kind of searching for, the new normal, we've taken a look at our sales and marketing strategy. We've talked a lot about the digital effects that we saw on the provider side, but that's going to have a ripple effect on suppliers as well. Adjusting your sales team and marketing strategy so that you are focused on this digital world now, or refocusing your efforts on it, assessing whether you've got the right sales team in place that can operate in a virtual world. As a salesperson myself, there's nothing like going and getting in front of the customer and having that interaction. So we've been forced to sort of adopt, a lot of virtual meetings. We've been very clever about it. You've got those lunch and learns that you introduced. So, it's forced us to reassess our business completely and how we get product to the suppliers. Right now we're in sort of a maintenance mode for the upcoming flu season, but hitting 2021 hits, hopefully, we can launch and hit the ground running.
Yeah. And one other thing I'll add to that too is we're working on developing more products right now. And as we choose suppliers for those parts and components, that's really shifted our mentality too. You know, having the ability to have most of our materials sourced from the United States really helped us during that surge. So I think that's something we're definitely going to continue to do as we add to our product portfolio as well.
Yeah, the one takeaway I had, I was on a council, Zoom meeting. It was supposed to be in person, but the one takeaway I had was the same echo that all these VPs of supply chain say is, if you're a supplier, make sure that your supply chain of raw materials is de-risked. Meaning if there's risk in you not being able to deliver product, we're going to find it now. So, I think that's incredibly impactful as a supplier.
Yeah, absolutely. And then I guess last question for you guys. What is CME to start? And then Joe, I'll ask you about Altus, doing to meet the growing demands of telehealth, since we've been talking about that a lot today.
I'm going to jump in here. Thanks, Sarah. It's a great question, but I'm going to kind of broaden the question. I'll let Joe and Shannon talk about telehealth specifically, but I think, looking at life after COVID, and I don't know when that's going to be, but, during this time or with COVID and into the future, I think it's really, really, really important to stay close to our customers, find out their pain points, really try to figure out how to solve their problems, because the suppliers that help, we're going to go through a lot of pains in the next few years, and the more we can stay close and help our customers solve problems, the better we're going to be, and the better off the industry it will be. And as far as telehealth, I think that's part of it too. If that's what they need, then we're going to figure out ways to help them.
Yeah, that's a great answer, Cindy. Shannon, do you have anything else to add from the CME side?
Specific to telehealth, one of the things that CME is doing to meet the demand, we've really expanded our knowledge on telehealth, and we have a growing sales team across the country, and with the help of great partners like Altus, we tap into the resources that we have and make sure that we're up to date on equipment and resources that are available to us. So I think that's one way, that we're helping, meet that demand.
And then Joe, from your perspective, what do you think we're doing to help meet the demands of telehealth as it is now, and where do you think it is in the future?
As a cart supplier, and point of care supplier, we've always kind of been on the fringe. The software is really the driver of these products. But as we heard, the digital efforts within hospitals are just vast, and we kind of sat down and worked with a few key suppliers during the surge to develop a virtual visitor cart, essentially something you can slap a tablet on. They can use it for remote patient monitoring or even visitors. We all know that was restricted. So we've got that product launching. And prior to COVID, we even had, the telehealth carts with the camera mounts and all of that stuff. But, we continue to look for opportunities within that space. And each hospital does things, slightly different, and all software applications are slightly different.
Yeah, well, great. And thanks, Cindy, Shannon, Joe, for joining us today and answering questions. I know we have a couple other topics we want to discuss in the coming weeks, but appreciate all your thoughts and effort going into this.
Thank you.
Thanks, Sarah.
All right.
Thank you.